In this video, I will show you the 4 best sciatica exercises for fast leg pain relief. You can easily follow along with me. Keep watching. Most sciatica exercises you find are done lying down, but that's not always realistic for some people. If getting to the floor is too painful or lying flat makes your symptoms worse, standing exercises are a game changer. They're easier to do when you're at work, at home, or anywhere with limited space. You don't need a mat, equipment, or even to change clothes. Best of all, these movements can loosen tight muscles and relieve radiating leg pain without having to lie on your back or having to think about getting back up again after that. For many people, standing is the only position that doesn't aggravate their pain, and if that's you, these sciatica exercises could be your breakthrough. The goal with these standing exercises is to centralize the pain. That means you want the leg pain to start moving upward from your left leg back towards your lower spine, or right leg if that's the case. That's a good sign. It's called centralization, and it usually means the pressure on the sciatic nerve is starting to ease. In general, it's much better to have more back pain and less leg pain than more leg pain and less back pain. Please watch to the end for a bonus exercise, a powerful standing lower back mobilization that can help relieve disc pain and calm nerve irritation, especially if your sciatica is caused by a bulging disc. Let's get started. All right, exercise number 1 is what we call the standing sciatic nerve floss. So understand, a lot of people confuse this. A nerve floss is not a stretch. Think of you flossing your teeth. You're not actually getting that floss to actually lengthen. When we're stretching, we're actually trying to lengthen a muscle. With a nerve floss, we're just trying to get that nerve to go back and forth. So Tanya's going to start by simply putting her foot on any small little pad, anything at all. You could throw well, now I'm dating myself, an old telephone book down there. There are obviously a number of things you can get in the fitness stores and so forth. And notice the movement is just simply pulling the foot towards you and then moving the foot away from you. And you're literally just getting the nerve to move back and forth. You can follow along with me here as well with Tanya, and we're going to do 10 reps of each exercise. So please do the 10 here. Watch, the movements are very slow, very controlled. We're literally just getting the nerve to move back and forth. We're getting literally some movement to unstick the nerve, so to speak, because a lot of nerves get adhesed and stuck and so forth. After the 10 reps of that, after we've done this 10 times, very controlled, we're making sure the rest of our posture, is nice, where we're, making sure we're engaging the core and so forth. Then if we want to advance that a little bit more, you're going to see Tanya's going to add some head and neck movement to this as well. And again, all this is doing is it's actually pulling on that nerve that much more. So this is a bit more of an advanced move. If you find that you have any balance issues, then please use the other hand to hold on to the wall or hold on to something as well. But let's focus on what we're trying to accomplish. We're going through 10 movements of literally flossing that nerve, so to speak. So take your time. Okay? Make sure that you're going through the movements properly, and you'll find that this will actually help release that nerve and ease some of the pressure off that as well. Exercise number 2 in our 4 best standing exercises for sciatica is what we call the standing piriformis stretch. So it's important to understand what you're trying to accomplish here. So now we've moved to a stretch as opposed to the nerve floss. The piriformis muscle is a muscle that comes across the back of the hip, and it's what we call a lateral rotator. So it'll actually rotate the hip back and forth. What makes this so important in terms of sciatica cases is in about 80% of the population, that sciatic nerve goes right underneath that piriformis muscle. So if that muscle becomes too tight, it can't help but compress on that nerve. In the other 20% of the population, that nerve literally goes right through that muscle. So again, if that muscle is too tight, too contracted, again, of course, it's going to put pressure on the nerve. So what we want to do is we're going to try to stretch that piriformis, that lateral rotator. Now, to do this, again, this is a balance move. There are a number of different ways to do this. This is one that we find the most effective that you should feel. So you're noticing Tanya's crossing the legs, and then she's gently bending down. Again, if you need to hold on to the wall, do that. We've now moved to a stretch, so we're not going to do 10 sets of stretches here. But what we are going to do is we're going to hold this for a good 20 or 30 seconds. You don't have to count. What you want to do is you actually want to feel that stretch ease up. So a lot of people just count, they go through the numbers, and they've never accomplished what they really want to accomplish. What you want to do is you actually want to feel what you're trying to feel. You want to feel that piriformis muscle ease up. You should feel a good stretch when you start, and after holding it for a while, you should slowly start to feel that the stretch doesn't feel as stretched anymore, and that's because the muscles actually lengthened and got used to the new length. We're now shifting to the other side, and again, you can follow along with all these. If balance is an issue, make sure you're holding onto the wall. As I said, there are other easier ways to do a piriformis stretch, but we find them not quite as effective. Make sure you're breathing, make sure you're maintaining all the core activation, but you want to feel that stretch across the back of that hip where the piriformis is. And again, hold it till you actually feel that stretch ease up. If you're really gung-ho, when you feel the stretch ease up, you could try going a little deeper to feel a little bit more of a stretch, and then again, hold it. But again, we want to accomplish what we're trying to accomplish. The piriformis muscle, huge factor in a lot of sciatica cases. But again, one of many different things. Sometimes people just focus on the piriformis and they forget all the other things. That's why we're doing the 4 best standing exercises. All right, number 3 on our list of the 4 best standing exercises for sciatica is something called a standing lumbar extension. So very simply, lumbar obviously is the lower back. Extension means that we are going to come backwards. So Tanya's coming backwards. Again, you want to go back. When we're stretching, you want to go back to the point where you feel a good stretch, you feel good movement, but never to the point that it's actually causing any sharp pain or recreating that sciatica. What becomes so important here, and again, you can follow along. We're going through 10 different reps here. Think of what's happening. If your sciatica is coming from a disc bulge or a disc herniation, so again, when that happens, I don't know if you can see that there, but when that disc bulges out, it's going to put a tremendous amount of pressure on that nerve. This is what becomes so important. A lot of people who think there's just the average exercise for the average low back case, that's simply not true. If you have disc herniations, disc bulges, what you don't want to do is you don't want to be bending forward, because when we bend forward, think of that disc bulge or herniation like a jelly donut. The more I squish the front of the jelly donut, the more that's going to actually increase that pressure on that disc bulge or disc herniation. So that's why in the lumbar extensions, we're doing the exact opposite movement so that we don't aggravate that disc bulge or disc herniation. This is why it's so key to go to a good health professional who understands this. There's no such thing that makes sense where it's the top 3 exercises for all low back cases. You have to be specific as to what you have and specific to knowing the underlying causes, and then you design exercises specific to dealing with that. A completely different exercise for someone suffering from a disc bulge or a disc herniation versus someone suffering from spinal stenosis. 2 exact opposite movements, in fact. And then, of course, what can complicate matters is you might be suffering from both. So again, that's why a good health professional understands as well. Definitely always an asset. All right, exercise number 4 on the 4 best standing exercises for sciatica is what we call the standing lateral hip shift. So what you're literally trying to do is you're literally trying to shift your hip one way and then back the other way. Okay? Often this can be done against the wall as well. Here we're doing it straight on so that you can see the movement that's happening. So you can see Tanya's doing very subtle moves where she's shifting to the one side, she's holding, she's shifting back to the other side. And what we're trying to do is we're trying to restore some function and movement back into the hips. Understand that hips joints, they don't just move in one way. Okay? A vertebrae will actually move in 6 different directions, what we call flexion, extension, right lateral flexion, left lateral flexion, right rotation, left rotation. You want to restore all of that movement back to the spine and back to the hips. Other thing that people need to know is your kindergarten teacher was wrong when they had you say, put your hands on your hips. People always put their hands here. Your hips are actually down here, but they're all part of the same complex. So this up here is more the pelvis. This is the hip, but we're restoring movement back in there. Okay? That is of key importance. A lot of people, and again, you can follow along here if you're not already, a lot of people, again, just go through the motions, or they tend to do what they're good at. So we'll see this in the clinic all the time, is someone thinks they're very flexible and they're great at going down and touching their toes, and they are terrible at bending backwards or bending to the right or the left or rotating right or left. So they're good in one of the 6 movements that the spine should be doing. And then what do they keep on doing? They do the one they're good at. And what are the ones they need to do? The ones that they're not good at. And yes, as promised, your bonus exercise. So in our 4 best standing exercises, this is number 5. So number 5 is the standing pelvic tilt. This becomes incredibly important. So pelvic tilt, again, we were just talking about the pelvis. A pelvic tilt should be able to move forward and be able to move backwards. And for most people, they spend all day long sitting at that desk or computer with the pelvis stuck in one position. So if you're watching, and this is why, again, we're doing the side view of here, and again, follow along, is the movement is such that you're bringing the pelvis forward, and then you're bringing the pelvis backwards. Some people confuse this, where it all depends, are you talking the top of the pelvis, the bottom of the pelvis, so what's an anterior pelvic tilt versus what's a posterior pelvic tilt? Typically, you go by the top of the pelvis, so an anterior pelvic tilt is going to go this way. If you're doing this on your back, you would find that it would actually increase the arch in your back. If you're doing the posterior pelvic tilt and you're lying flat on your back, you would find it would actually flatten out your back. But when we're standing, you can see that we're restoring movement back and forth. So again, you come back, you hold, okay, and then you go the opposite direction. We want to restore movement and function back to the pelvis. Remember, the pelvis and the hips are basically the foundation for the rest of the spine. So all of these things are going to affect all the muscles, all the ligaments that attach. All these things are going to affect the sciatica that you're suffering from. They can also obviously have an impact on the disc herniations and the disc bulges. It's important that this is balanced and has its normal function, because otherwise your spine is on a poor foundation. Think if you built your house on a crooked foundation, or essentially you're like the Leaning Tower of Pisa. So that's something that we want to restore normal movement, and we don't want to forget to breathe while we're doing all of these exercises. A lot of people want to hold their breath for some strange reason. Breathe, make this normal. And the cool thing is, the more you do this, the more this will become the norm. When you first start, you may find this uncomfortable to do. The more you do this, the more this will become the norm for you, and that's what we want, because it is normal. You now have 5 great standing exercises to help relieve sciatica and leg pain, even if lying down isn't an option. If you found relief with any of these, like and share the video to help someone else who's struggling as well. Let me know in the comments which exercise gave you the most relief. If you're dealing with ongoing back and nerve pain and you want real answers that don't involve drugs or surgery, subscribe now. This channel is dedicated to helping you finally feel better and live better. The next video you should watch is 5 easy-to-do exercises for quick L4, L5 disc herniation relief, especially if your leg pain is coming from an L4, L5 disc bulge or L5, S1 disc bulge.